Happy American Pharmacist Month. With it being American Pharmacist Month, we thought it was really important to focus on the critical role the pharmacist plays in improving outcomes in public health. From serving as a vital community resource, delivering hundreds of thousands of vaccines, to ensuring patients are on the right antibiotic at the right dose for a life threatening infection. You, as pharmacists, play such an essential role for your patients, so thank you for all that you do. Before we dive in, I'd like to introduce my guests today. APhA Executive Fellows, Nick and Yara. Nick and Yara, why don't you introduce yourselves?
Yeah, so hi, I'm Nick, one of the Executive Fellows in Education, and happy to be here. Happy to get started on this.
Hello, I'm Yara. I'll share. I'm the other education fellow here at APHA.
All right, thanks, Nick and Yara. With that, more specifically this month, we're going to focus on the great work pharmacists are doing to support patients with substance use disorder. According to a 2022 national survey on drug use and health data released by HHS and SAMHSA, 48.7 million people aged 12 and older, or 17.4% of the US population, had a substance use disorder. As frontline providers, pharmacists encounter patients with substance use disorder on a daily basis, and this is an area where practice authority continues to evolve. Did you know that in 11 states, pharmacists now have authority to prescribe controlled substances through some mechanism, whether it be a collaborative practice agreement, statewide protocol, or independent prescribing authority? This includes medications for opioid use disorder, and there are pharmacists out there taking the lead and serving these patients in need. In fact, the National Association of Boards of Pharmacy and National Community Pharmacists Association just published the Pharmacy Access to Resources and Medication for Opioid Use Disorder, or PhARM OUD guideline, in collaboration with the University of Houston College of Pharmacy, and that will be the topic of discussion for today. During part two, I'll welcome an expert in the field who's really dedicated his life to supporting patients with substance use disorder and educating pharmacists on how to do the same. I can't wait to introduce you to him. So let's dive into this publication, which is designed to equip community pharmacists with essential tools to help them enhance patient care. The PhARM OUD guideline provides 9 major recommendations and 35 additional strategies designed to eliminate confusion and fear surrounding the dispensing of buprenorphine. While we won't have time to review all of these today, we'll focus on a few and certainly encourage listeners to review the full publication. So let's dive in. Yara, can you give listeners a high-level overview of the 9 core recommendations that are included in the PhARM OUD guidelines?
Of course, the first recommendation, maintenance pharmacotherapy with buprenorphine, suggests that pharmacists should keep an adequate supply of buprenorphine in their pharmacies and be ready to dispense it to patients with opioid use disorder. It also highlights that refusing to dispense buprenorphine may disrupt treatment, cause withdrawal, and heighten the risk of opioid relapse and death. The second recommendation, potential indicators of misuse or diversion in prescription drug monitoring programs, suggests that pharmacists should utilize state prescription drug monitoring programs to inform their buprenorphine dispensing decisions, supplementing their clinical judgment rather than replacing it. The third recommendation, early refills, suggests that requests for early refills of buprenorphine should not automatically be viewed as misuse. They may be due to legitimate reasons such as dosage adjustments or changes in residence. Before making a dispensing decision, pharmacists should discuss the context of the request with the patient, contact the prescriber, and document their rationale for dispensing or declining the prescription. The fourth recommendation, telehealth, suggests that pharmacists should dispense buprenorphine prescriptions from telehealth providers if the prescriptions are legitimate and the pharmacist can fulfill their corresponding responsibilities. The fifth recommendation, buprenorphine monoproduct. This recommendation states that current clinical evidence supports the safety and efficacy of buprenorphine monoproduct for the treatment of opioid use disorder. The sixth recommendation, optimizing the safety and effectiveness of buprenorphine pharmacotherapy, suggests that pharmacists and pharmacy technicians should optimize the quality of care for persons prescribed buprenorphine. We will discuss more details about this recommendation later on. The seventh recommendation, care coordination and prescriber communication. Pharmacists can support patients with opioid use disorder by providing comprehensive services like medication management and immunizations, implementing collaborative practice agreements for therapy monitoring, promoting adherence through referrals, and ensuring direct communication with prescribers. Additionally, they should consider dispensing partial quantities of buprenorphine when they cannot promptly reach a prescriber to prevent care interruptions when needed. The eighth recommendation, stigma towards persons with opioid use disorder. Pharmacy staff should approach patients with opioid use disorder with empathy and compassion, actively recognizing and addressing their own biases to provide patient centered care. And the last recommendation, the ninth, employer oversight. Pharmacy policies should promote flexibility in buprenorphine dispensing, allowing pharmacists to exercise their professional judgment when making dispensing decisions.
Thanks so much, Yara. That was a great overview of the recommendations that are provided. I want to take a little bit more closer look at recommendations 1, 6, and 8 specifically. So, Nick, why don't you help me by reviewing key points that for pharmacists related to recommendation 1, maintenance pharmacotherapy with buprenorphine?
Of course, yeah. So, first, it's important to remember that opioid use disorder is not a short term illness, its recovery is lifelong. With buprenorphine, there is no maximum safe duration and no minimum effective duration of therapy. What is known is that there is an increase in risk of morbidity and mortality for treatment durations or treatment episodes less than 180 days. And treatment durations longer than 365 days show significant reductions in mortality. The length of treatment is entirely dependent on the prescriber's clinical judgment and the patient's individual circumstances. Our role as pharmacists is not to question the length of treatment, but to support patient care and provide life saving medication throughout the needed treatment duration. Secondly, I really want to talk about maintaining an adequate supply. A survey from 2022 found that only 48% of nearly 6,000 pharmacies across 11 states were willing and able to dispense a 1 week supply of buprenorphine. We're talking much longer durations of therapy here, so we're going to need more than a week at a time. More recently, roughly 58% of a similar number of pharmacies reported buprenorphine availability, so the number's getting better, but we're still not where we need to be. Also, in 2022, the average dispensing rate of buprenorphine was 4.8 prescriptions per 100 persons, which equals roughly 16 million prescriptions in that calendar year. That number is held pretty steady between 2019 and 2022, and we're still kind of waiting for more data from 2023 and 2024. So this is all to say that it's important to appropriately manage on-hand supply within the pharmacy to prevent any disruptions in patient care and management of opioid use disorder. And another point is when you are dispensing buprenorphine, you can still check the provider's DEA number if you think it's necessary when filling that prescription. However, you just won't see the X before the provider's DEA number going forward, as the MAT Act eliminated that requirement. If the patient has no contraindications, such as hypersensitivity to buprenorphine, and doesn't display any signs of misuse or diversion, you should feel pretty safe to dispense the prescription. What is the MAT Act, you might ask? I know I just dropped a name there. The MAT Act is a section of the Consolidated Appropriations Act of 2023 that removed the X waiver requirement for prescribing buprenorphine for the treatment of opioid use disorder. A concurrent act, the Medication Access and Training Expansion Act, or MATE Act, in the same bill requires new and renewing DEA registrants to include pharmacists, pharmacy technicians, interns, and assistants, and pharmacies in general to have completed at least 8 hours of training on opioid or other substance use disorders as of June 27, 2023. So if you're in the process of renewing, make sure you get your hours completed before you submit.
Thank you so much, Nick, for talking about the importance of access to long-term maintenance pharmacotherapy and recent legislative action that has been taken to accomplish this. Now, Yara, let's shift gears a bit to how pharmacists and pharmacy technicians can play a part in optimizing the safety and effectiveness of buprenorphine and review recommendation number 6.
Of course. So, as a reminder, recommendation 6 is optimizing safety and effectiveness of buprenorphine pharmacotherapy. So, this recommendation dives into ways that both pharmacists and pharmacy technicians can optimize the use of and quality of care for persons prescribed with buprenorphine. Let's first talk about things pharmacists can do. So they can provide patient counseling by informing patients about potential adverse effects of buprenorphine and encourage them to report any adverse events such as opioid-induced constipation, respiratory depression, dental cavities and or tooth loss, and increase in blood pressure. They can also dispense naloxone, so they can offer naloxone to patients prescribed buprenorphine to manage opioid use disorder. They can educate patients on potential drug interactions. So patients should be educated about the risk of certain drug combinations, such as full opioid agonists, benzodiazepines, sedative hypnotics, and alcohol use while taking buprenorphine. And finally, they can counsel patients on safe storage and disposal. Buprenorphine is stored at room temperature. It should be protected from light and kept out of reach of children. The best disposal option is for patients to find a drug take back location. And if they don't have a drug take back location near them, buprenorphine can be flushed down the toilet. Now let's shift gears to things pharmacy technicians can do. Technicians can enhance care efficiency by assisting with tasks such as accessing prescription monitoring program information, contacting prescribers, reminding patients about refills, and helping with reimbursement at the pharmacy. These are all ways on how pharmacists and pharmacy techs can optimize the use of and quality of care for persons prescribed with buprenorphine.
Great. Thanks so much, Yara. I personally found the call out to involving pharmacy technicians in the care of persons with OUD really impactful. Pharmacy technicians play such a crucial role in what we do as pharmacists, and the guidelines had some great recommendations for how they can get involved. All right, for the last topic of discussion today, Nick, why don't you review recommendation 8 for listeners, which focuses on combating stigma towards persons with OUD?
Yeah, sure. So I'll just cover just a few important recommendations within the guidelines to promote an experience that's free of stigma for patients. But first, I really want to mention APHA's Oath of a Pharmacist, which is cited directly within the PhARM OUD recommendations. When we stated the oath, we pledged to consider the welfare of humanity and the relief of suffering as our primary concern. By declining to fill legitimate prescriptions, we are creating stigma and continuing the suffering of patients in need, which is entirely antithetical to that oath that we all took. In keeping with that pledge, pharmacists should not require patients to transfer their non-controlled prescriptions to their pharmacy before dispensing buprenorphine. This creates an unnecessary barrier to care that may lead to a patient's reluctance to seek help. Another aspect to consider is that a patient might have a routine source of maintenance medication, or that patients who are uninsured or underinsured are actively seeking the lowest cost medications, and forcing them to transfer would be economically unwieldy and burdensome for the patient. We want our patients to feel that they can come to us without fear of stigma or rejection. We also want to move away from requiring patient interviews prior to dispensing buprenorphine. Asking why a patient is filling a medication or attempting to discern if a patient is likely to misuse or divert that medication via subjective questions can be seen as an attempt to deny care and lead to that patient feeling stigmatized to a degree in which they no longer view treatment as available. However, if necessary to clarify potential indicators of misuse or diversion, pharmacists should be direct and transparent about why they are asking for further information from the patient. It is important to note that buprenorphine misuse only occurs in roughly 1/4 of patients who take it, and that diversion of buprenorphine rate is actually lower than misuse rates at about 17%. Finally, everyone in the pharmacy can and should act with empathy towards those with substance use disorder or opioid use disorder and treat them with the same dignity and respect as you treat every other patient with. This can be as simple as how we talk to patients. We can ask if the patient is all right with questions about their opioid use disorder and treatment. We can reassure them that the discussion, while uncomfortable, is normal and necessary to help them. And as I said earlier, just treat them with the same respect as you would give any patient in your pharmacy.
Thank you, Nick and Yar, for providing such valuable insights into the recent PharmOUD guidelines, which are a great example of how pharmacists impact public health. We're going to dig into recommendation 8 in a bit more detail next week on our episode where I'll speak with Jake Nichols, a pharmacist who has committed his life to serving patients with OUD in an environment free of stigma and educating others about how to do so. So let's summarize key takeaways from our time here today. First, pharmacists and pharmacy technicians are crucial providers in ensuring access to buprenorphine and should manage their inventory and dispensing in order to do so. Pharmacists can provide patients with education about proper use, storage, and adverse events, and pharmacy technicians can help with prescription monitoring, refill reminders, and reimbursement. When serving patients with SUD, care should be taken to avoid processes like required transfers or interviews that create unnecessary barriers to access. We'll talk more about stigma next week as well. All right, folks, that's all the time we have here for today. Look out for part 2 of this month's First Fill podcast that will release next Thursday. For any listeners who practice in those states that I mentioned that have authority to prescribe MOUD, APhA has an 8-hour training program on initiating buprenorphine that meets MATE Act training requirements. Definitely check that out if you're looking to renew your license or become a provider to support persons with OUD. And last but not least, don't forget to head over to the Learning Library at learn.pharmacist.com to earn your CE for this month's podcast. We'd love to hear your feedback on how you like this new setup. Thanks so much and take care.